Okay, thank you so much. Hi, everyone. I hope you're enjoying the conference as much as I am. Honestly, I'm so energized and happy. I just feel joyful being able to be around so many amazing Black scholars, creatives, poets. It's honestly amazing, and clinicians. So thank you so much for your attention. So I'm going to be talking a little bit about anti-Black racism and the role that it plays in building interagency relationships in the mental health care sector. So to do that, most of my talk is going to be based actually on pathways to care research. I actually work at an NGO called Black Health Alliance, which is dedicated to improving mental health and physical health of Black Canadians. So I'm gonna move on and give a little bit of background about pathways to care. But first, my name is Melissa. I'm a researcher and I'm an evaluator. So a little bit more about me. I just like to get to know everyone a little bit more. So my research interests are varied, but right now my expertise lies in Black mental health. I do a lot of research as well in LGBTQ health. Health equity is also really important to me. And because I'm an evaluator, I'm always looking for innovative ways to kind of do evaluation in a way that's more culturally appropriate. Just to ground us in our discussion, I know not everybody's familiar with Pathways to Care or PTC, but what it was is that PTC was a 5-year systems change mental health project. It took place in Ontario. We actually ended up studying 6 different cities in Ontario. One actually was Ottawa, but for the purposes of this discussion, I'm going to limit it to our Toronto findings because those are the findings we used to publish the paper with the same name as the title of this presentation. And as you can see, our partners are listed here. So it was really a collaborative effort, and it wouldn't have been possible unless we kind of reached across to kind of end up engaging Black mental health agencies as well as mainstream agencies. So what I mean by Black and mainstream agencies, I'm going to be using those terms a lot during this presentation. During Pathways to Care, we defined an agency as Black as a mental health organization that is dedicated specifically to providing services for Black communities. And a mainstream agency just means an organization that does not do that. So CAMH, Youthdale, many other ones in the Toronto area. So our research goals were threefold. As you can see, we were primarily interested in learning about the role ABR actually plays in mental health care and the recovery process for Black youth. And then secondly, we also wanted to know a little bit more about clinicians' perspective. So how do they really feel about building interagency relationships with other organizations in the sector? Maybe what was stopping them, maybe why they were hesitant about it, et cetera. And then we also wanted to paint a visual picture of what the interagency relationships look like in Toronto. So a little bit more background. Everybody's pretty, I think, familiar with this, but just in case. So there's numerous research out there, and consensus has proven that ABR is linked to chronic stress. And in turn, that can lead to negative healthcare experiences for Black youth in the sector. And it can also lead to difficulties in accessing care, as well as higher rates of substance use, et cetera. So recovery-oriented practice, I just want to ground us in a definition of what that means. So I was looking at the implications for this work on recovery-oriented practice for Black youth. It's essentially a different approach to providing care that focuses less on getting rid or eradicating the I don't know if that's doing that. Getting ahead of ourselves. That's okay. It's focused less on eradicating symptoms, and it's more geared to instilling a sense of agency and helping people find joy while they actually live with their mental health conditions. So I do not know why this is happening. I apologize. So research in this sector, in terms of what it says about interagency collaboration, it's pretty clear. There's consensus in the research that greater collaboration between mental health organizations is conducive to more satisfaction among Black youth with their care. And it's also, it just leads to more efficiency with providing care and decreases the amount of racial disparities between Black and white children in terms of their complex service use. An overview, an overview of our research methods. So essentially, we conducted our research using 3 steps. We started with a scoping review that identified the barriers and facilitators to care that Black youth were facing in Canada. And then we moved on to conducting focus groups with family and community members, Black youth themselves, and then mental health clinicians. So the third method that I'm going to be focusing a little more time on, just because I led that part, so I'm way more familiar with it, are the social network analysis surveys. And I'll define what a SNA is in a minute. Don't know. So community involvement was central to this project because we used a community-based participatory research approach. I know some folks already talked about CBPR, so I won't continue, but that was important. And what set us apart is that we really allowed youth, we allowed mental health clinicians, everyone involved to kind of help us really craft our data collection instruments. So they were involved from the design phase, helped us pick, the types of questions we wanted to ask. And they also helped us co-write some publications as well. We allowed youth to kind of gain that experience so that they knew how to become researchers and kind of get acquainted with the publication process as well, because we know it's really hard as a Black youth, especially in my experience, to find mentors who will really, take a chance on you. So overexcited. Okay. So extra. Okay. So social network analysis, what is that? Just in simplest terms, it's just a way of studying the social structure of a network. And that could be a network of people, a network of messages. But for our purposes, for this project, it was a network of mental health organizations, like I said. So we divided them into mainstream and Black. At the center is youth, because ultimately we cared about how this impacted Black youth's care. And then we disseminated the survey to clinicians and leadership and staff at mental health organizations. And ultimately, we just wanted to see who was working with who, kind of speculate as to why there wasn't as much collaboration going on as we had hoped, and then identify areas for building stronger partnerships that last long. So here's a brief overview of what our participants ended up looking like. So they weren't too diverse in terms of frontline staff or their role at the organization. I think just over 60% were frontline workers, a little bit less for management. And then, as you can see, there's an overwhelming majority from mainstream agencies, which is unsurprising because, like I said, most of the mental health organizations that are in Toronto are mainstream. So what did this mean? What did we find? Essentially, we found this looks fancy. It's not as complicated as it looks. You can see on the legend, I'll explain what, don't know. So the legend here shows mainstream agencies are represented by these purple dots. The Black ones are the Black agencies, so simple enough. And then we see those lines, those black lines connecting all these dots. Those represent connections between agencies. What this social network graph actually shows is the past collaborations or partnerships that were formed between Black and mainstream mental health agencies in Toronto from 2019 to 2021. So in short, we can really see the key takeaways are not too much collaboration, unfortunately, going on between mainstream and Black agencies. And the largest nodes here were all mainstream agencies, which actually served as bridges. And a bridge in an SNA is just an organization that has a lot of influence. It has strong influence over the communication in a network. So if it was removed, communication would be distorted and the network would be a mess. So a lot of those were mainstream. And I believe, honestly, one of them I'm fairly certain was CAMH, but I didn't include all that text because that would be messy. So unfortunately, you can see a lot of the Black agencies are on the outskirts of the graph, meaning that they cited themselves as past collaborative partners, or they indicated they didn't really work with anyone else on their mental health work. So in terms of what another graph that I created just has to do, it's based on a survey question I asked leadership and I asked clinicians. What I asked them is, who do you want to work with in the future? What mental health organization are you really passionate about helping you out with your work? And interestingly enough, maybe unsurprisingly, most folks actually mentioned wanting to work with mainstream agencies. Very few mentioned wanting to work with Black agencies. And a lot of that was due to them just simply not knowing that we exist. They were just unfamiliar with us. I had many a great conversation with CEOs, EDs, and they were passionate, claimed to be interested in wanting to help Black youth with their mental health, but they just had no idea, allegedly, how to do that, didn't know what other people were doing. So that's unfortunate because we want other people to really recognize our work. We're doing the work and we know that it works. But unfortunately, we need to prioritize, coming together and working together more. So what does this work mean for clinicians and leadership? This research, I organized it here into these areas. And these are the areas that I think clinicians and leadership can target. So this is a really high level summary in order to improve how they care for Black youth. So clinicians, they can collect more race-based data. We believe they can do this through intake. They can do it on their own. You don't even necessarily have to have your funder or the government let you do it. And there are innovative ways to do that. We can start to use culturally adapted tools. We've learned about many different ones. CBT, I'm sure there might be a DBT one in the works. So we need to start collaborating together. And if you don't know how to use those, I guarantee you there's someone who does. So it's about forming those reciprocal relationships and reaching out and seeing where you can come together and avoid the duplication of work and wasting resources. So Black therapeutic modalities is also there. And by tools, I mean evaluation tools, different frameworks to help you do needs assessment, things like that. There are Black focused ones for sure. BHA is actually working. We just finished a needs assessment one, so there you go. And we're working on one that has to do with how to engage Black communities in general, just for public health projects. And leadership here can focus, like other people have mentioned, Black representation, but I don't want to see just mental health care workers represented more. That's important. I really want to see, after all my discussions with a lot of different mental health organizations in Toronto, I want to see more of us in leadership roles. That is very rare. So I think without that, a lot of these DEI training initiatives that we talk a lot about at this conference, they're all valuable. I don't believe that they'll actually be sustained unless, we're in positions of power to make sure that continues to happen. Evaluation support is important here too, because a lot of the Black agencies I talked about did not have strong monitoring and evaluation infrastructure in place. And if we don't have that in place, it's really hard to demonstrate our impact to funders, demonstrate it to other mainstream agencies, and kind of prove what we already know is that this works. But, if we're not measuring it in an active way, then we can't really show that to others. By interagency data sharing, I think it's important for leadership to prioritize that, because we have a lot of valuable data, everybody does, and Black agencies, I think, as well as mainstream, don't always share what they know. So it's race-based data, clinical data. You can think of other data about your own projects that, would be valuable for your partners to know. So the last takeaway I want to leave you with is that ABR is a formidable barrier to building interagency partnerships in the mental health care sector, but it doesn't continue to have to be. There are things we can do about it. And I really hope that future research actually focuses on identifying what those specific barriers and facilitators are, in addition to ABR, and preventing us from working together. And it's important that the recovery-oriented practice guidelines, you can look them up. Mental Health Commission of Canada published some in 2015. I am really an advocate for them identifying ABR as an actual social determinant of health that negatively impacts recovery for Black youth. Thank you so much. Also, you can contact me there if you'd like to hear more or read some more about all our papers. PTC's been busy.